I am a physician retired from the Navy. I started off my career as a Marine Corps officer, then left the military service, took my GI benefits and went back to medical school, came back on active duty in the Navy with the understanding that I wanted to provide medical care to Marines, and they were very happy to accommodate that. I was fortunate enough to serve mostly on the East Coast with Marines and ended my final assignment before I retired from the Navy as the Director for Expeditionary Medicine in Washington, D.C. My job there was to plan the medical assets that go out with forward deployed Marines. It was a little more than a decade ago, I, as a physician, paid attention to my health and had bone scans and knew that I was developing osteopenia. My whole course was complicated by the fact that I also have fairly severe osteoarthritis. As a physician, of course, I knew that weight-bearing exercise was good for osteopenia, but I was hampered by the fact that my arthritis limited my activities. And then over the course of about a 3 or 4 year period in the early 2000s, I ended up having both hips replaced, which also reduced and limited the things I could do. And what I found was happening was that I was doing less and less, and the less I did, the less I could do, and it was like my world was just shrinking and shrinking and shrinking, and I didn't want that. I heard about the Bones in Balance class from the Lakeland Health Currents magazine and talked to my physician, Dr. Alamente, about enrolling in that, and she was a very enthusiastic supporter, so I went off to the class and was very pleasantly surprised at what I found. I went to the class and was joined by 5 other very delightful ladies. We had instruction on nutrition, learned some great information about how to calculate how much calcium is in the food you eat, no math involved, and I was very thrilled with that because I'm not a good person for doing math in my head. We talked about the medications that are available, and then the most useful part had to do with the exercise program that the physical therapist put together, individualized for each of us. They were really great about working around any limitations we had, and I found that as we started off, I was slowly gaining back my flexibility, my strength, my balance, and the world was opening up again. I was back to feeling better with less pain from my arthritis, able to do more things, and back probably to the level that I hadn't been at in more than a decade. I felt so much better. And I talked to the physical therapist and said, you really need to tell more people about this class. One of the nice things about this class is it's not just the subjective, oh, I feel better, I think I'm doing better. When you enroll in the class, they do measurements of your range of motion on the joints you have, things like your height, grip strength, your weight, just overall measurements that are things that can be followed, and then those are done again at the end of the program, and I actually had tangible proof that it wasn't just my imagination, I was feeling better, that there were significant gains. Sherry and Abby are fabulous, very enthusiastic, and as I have told other people, I'm really willing to help people tutor a program that is tailored specifically to your needs and whatever limitations you have, so that was great. I highly recommend the program to others. One of the things I've discovered in my enthusiastic sales pitch to people I've run into is that women tend to have 2 concerns about this class, and I'm here to tell you that neither one of them are founded. People are concerned that the exercises are going to be too hard. This will be like sweaty junior high school gym class. It's not like that at all. The exercises are gentle and they're actually quite fun. The other concern people have is about going to the gym and how they're going to be perceived among all these other people. Let me assure you, this is not beach babes in spandex. These are women of all ages, sizes, and shapes who are in the class for one purpose, and that's because they want to feel better. So I highly recommend that people put on their comfy clothes and join the group.